Good morning and welcome everybody. So ladies and gentlemen, there's a bit of some noise in the background. We're going to get started. Welcome to meeting 6 of the Board of Health. Welcome to members of the board, to other members of council, and to members of the public. You can follow the agenda and debate on your computer, tablet, or smartphone at toronto.ca/council. We will begin, as we always do, by acknowledging the land we are meeting on is the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, and is now home to many diverse First Nations, Inuit, and Métis peoples. We also acknowledge that Toronto is covered by Treaty 13 with the Mississaugas of the New Credit. And to Board of Health members, thank you for yet another meeting. It has been an exceptionally busy period. Let me begin by seeing if there are any declarations of interest under the Municipal Conflict of Interest Act. Seeing none, could I have someone move the confirmation of the minutes from the April 8th and April 15th meetings, moved by Peter Wong. All those in favor, opposed, if any, that carries. You have in front of you on the green sheets a list of speakers, and please note that a number of speakers are being added to the first item. We are going to begin by going through our yellow sheets, orange sheets. So let me begin our first item, the 2019-20 Ontario budget announcement for Toronto Public Health. We have a staff presentation and speakers, so that will be held. The second item, HL 6.2, the Student Nutrition Program, I'd like to hold that, please. So that will be held. The third item, HL 6.3, Service Agreements awarded and executed by the Medical Officer of Health for 2019. Okay, nobody to hold. Would somebody like to move the recommendations there? Angela Johnson, all those in favor, opposed, if any, that is carried. Item HL 6.4, Board of Health meeting procedures. That's the exciting item on the agenda today. It's exciting to Councillor Perks, very controversial. Seeing no one holding that, would somebody like to move? Councillor Perks, I trust you'll, we're holding that for a presentation. Okay, my forgiveness. We are holding that for a presentation. And finally, HL 6.5, 2018 Performance Appraisal. Medical Officer of Health, our subcommittee did meet. We have recommendations in front of us. Would somebody like to move those? Trustee Donaldson. All those in favor, opposed, if any, carried. The recommendations are confidential, but I think we're planning to keep you, Eileen. All right. We are going to return right off the bat to item 6.1, the 2019-20 Ontario budget announcement. For members of the public, we're going to start with a presentation from our Medical Officer of Health. We're then going to move to hear from speakers before taking it in committee. So at this time, let me turn it over to Dr. Davila.
Thank you, Mr. Chair. Good morning, everybody. Good morning to the members of the Board of Health and to those who are visiting us here today. I will take you through a very quick presentation in respect of the 2019-2020 Ontario budget and its specific implications to Toronto Public Health and the work of this board. And as you heard from the chair, there will be an opportunity for others to present, but I'm of course happy to take any questions you may have in respect of the presentation. So moving to the first slide, just to provide you with a bit of a recap on that which was handed down when the provincial government made its announcement back on April 11th in respect of its new budget. There were a number of items that had specific relevance to public health, and those items, for those of you who are particularly interested in looking at the budget document itself, those items can be found on budget document pages 119, 125, and 277. So they were sprinkled throughout the budget document, but they've been summarized for you here on this slide. The first comment that was made in the budget document was the province's intent to adjust the provincial municipal cost-sharing arrangement in respect of public health funding. The second key item that came through the budget document was that the province had a plan to establish 10 regional public health entities and 10 new regional boards of health with one governance model by 2020-2021, and that's a change from the existing 35 local public health units. The third major point of note in the 2019 budget document was the province's intent to render a $200 million savings, annual savings, by 2021-2022 through that regionalization process and governance changes that I've addressed already in the previous point. And the final point worthy of note was that the provincial government in the budget document indicated a plan to invest approximately $90 million for a new dental program for low-income seniors. And the issue here, the relevance to public health, is that there are 3 agencies through which those services are meant to be provided, one of which is local public health units, or ultimately regional public health entities, the other 2 being Aboriginal Health Access Centres and community health centres. So moving on to the next slide, those were the details that were provided back on April 11th at the budget document and the budget launch itself. The week following, more details were provided through various teleconferences that were held between local public health officials, chairs of boards of health, and representatives from the Ministry of Health and Long-Term Care. The details with respect to the change in provincial municipal cost-sharing arrangements was one of the details that was provided in the subsequent week. And in particular, for Toronto, what that looked like was a change from the current and long-standing provincial municipal cost-sharing arrangement, where the province pays for 75% of the vast majority of programs, and the municipality covers 25%, to the change that's described here on the slide. And it's a gradual change that was characterized and described to those of us as we listened to the ministry provide their information. So what has been proposed was for 2019-2020, that for Toronto, we would see a change from that 75-25 cost funding arrangement to a 60-40 split, that split would continue for 2020-2021, and that ultimately, in the year 2021-2022, that cost-sharing arrangement would change to a 50-50 split. To give you a sense, based on those numbers, and based on the information that we were provided, we had to try to calculate what this actually meant specifically for Toronto Public Health. And as depicted on this slide, what we were able to ascertain based on the information that was made available to us was that the change in the funding formula would require an additional $25 million, or a 58% increase in the City of Toronto's contribution to maintain the budget approved by City Council, and this is for 2019. And as you can see on the second point below, the corollary to that, or the natural extension of that, is that should the city be unable to make an additional investment of $25 million, the impact of the change for 2019 for just Toronto Public Health is a $65 million reduction in the provincial budget. And again, you'll note on this slide, this is premised on certain key assumptions. First, that estimate is based on the 2018 approved allocation for Toronto Public Health. Second, it's premised on the 2019 City Council approved budget for Toronto Public Health. And finally, it supposes or assumes an effective date for the funding changes of April 1st, 2019. So another way of saying this, for those of you who are a little more visually oriented, this is effectively a depiction of that which I just said, particularly that second point, that as we go to this new funding formula, relative to the previous funding formula, based on those assumptions that I've just described, we are in a situation where we see a potential for a $65 million gap for the 2019 budget for Toronto Public Health. Just by way of reminder, I've already mentioned some of these points, but just want to be clear that the funding arrangements on the go-forward basis, as they've been described by representatives of the Ministry of Health and Long-Term Care, for the year 2020-2021, the cost-sharing arrangement has been proposed as being 60-40, And for 2021, 2022, we know that the ministry has indicated an intent to move towards a 50-50 cost-sharing model. And this is a model that's specific for Toronto Public Health, or at that time, again, keeping in mind that there are governance changes that have been proposed, that 2021-2022 figure and that 50-50 split is between the province and what is now being called a Toronto Regional Public Health Entity. I will also remind you, just on the final point on this slide, that as per the budget document, one of the intentions expressed by the provincial government through their budget document is this notion of achieving $200 million in annual savings through that regionalization process and the governance changes that they described. Again, not in great detail, but what's been provided at a high level. What we don't know is that clearly there must be some element, given that Toronto is one of the local public health units that's captured within this change and subject to the regionalization and the change in governance model, there must be a share, one would anticipate, from Toronto in order to achieve that $200 million in annual savings from the regionalization governance change proposals. We have heard that there is a proposed mitigation strategy to support boards of health as they go through the transition that's been put forward by the provincial government through its budget document and through the subsequent conversations that we've had to date. And it's our understanding that amongst the mitigation measures that are available to those of us in the public health sector, one of them would be one-time funding to help mitigate the financial impacts on municipalities, and the other that's been floated or proposed by Ministry of Health and Long-Term Care colleagues in the conversations that we've had to date includes something along the lines of exceptions or waivers to the existing Ontario public health standards. Unfortunately, members of the board, I am unable to provide you with further detail in respect of either of these two mitigation strategies, as none have been provided by our colleagues at the Ministry of Health and Long-Term Care. That being said, we do know, as I've mentioned earlier, that there is a governance model change. This is the extent of the detail that we know at this point in time. 10 regional public health entities governed by autonomous boards of health. And this is the straight wording. These are not my words. These are words selected or lifted, if you will, from the provincial budget document. That's how they've described it, as having strong municipal and provincial representation. And as I mentioned earlier, they've indicated an intent to create these entities by 2020, 2021. Pretty ambitious timeline, given that it is May 2019. Affecting a new organizational structure and having new entities in place in less than a year is ambitious, I would say, at the very least. And we don't have yet any details in respect of what that looks like. We do know, however, that one of those 10 regional public health entities will be a Toronto Regional Public Health Entity. I'm not suggesting that's the name. Our colleagues at the Ministry of Health and Long-Term Care have indicated that the name has yet to be determined, but for now it's characterized as a Toronto Regional Public Health Entity. In terms of next steps, and this is the final slide, the Ministry of Health and Long-Term Care has indicated an intent to engage in conversations with public health units on a one-by-one basis in order to discuss, hopefully in greater detail, the plan changes for 2019, related mitigation opportunities, and to understand what's required, what might be the next steps in terms of planning, in terms of ensuring that local needs continue to be met, what the priorities look like as far as they're concerned, so that we can understand the agenda and how it can actually be managed, how we can ensure that we're protecting and promoting local public health in all this transition that's currently being proposed. So with that, thank you, Mr. Chair, and I'll turn it back over to you.
Thank you, Dr. Davila. We're now going to go to deputants before bringing it back into committee for questions. So we're going to hear from speakers first before we bring it back for questions. We have a series of speakers and some new additions to the green sheets. Our first speaker is Dr. Robert Kyle, President of the Association of Local Public Health Agencies. as well as the Medical Officer of Health for Durham. Do I have that? Yes. Dr. Kyle, good to see you again under the circumstances. You can take a seat there. The mic will be turned on for you. You'll have 5 minutes, which there's a clock on my right that you can see, which will start anytime you're ready.
Okay, so good morning, Chair and members of the Board of Health, and Dr. Davila and your team members who are present. I do have prepared remarks, and I've given them to the Secretary for distribution. So I'm Dr. Robert Kyle, President of the Association of Local Public Health Agencies, known as ALPHA, and I'm pleased to be back before you today, and with me is Loretta Ryan, who is ALPHA's Executive Director. And just as a reminder, ALPHA represents all Ontario's 35 boards of health and medical officers of health. Since my last appearance, ALPHA has continued to be very engaged and has supported its members with what the Ontario government calls public health modernization. In the short time that I have here, I want to bring to your attention, for example, what we believe are 2 important pieces of correspondence that we have prepared in support of our members. On April 23, 2019, we released the ALPHA position statement. In it, ALPHA stated it remains concerned about the proposed cuts to provincial funding for public health, especially for Toronto. It is concerned about the lack of details regarding the replacement of 35 boards of health, public health units with 10 regional public health entities, the ambitious timelines, the magnitude of the changes, the disruption to the public health system, and in particular to frontline public health programs and services. Accordingly, ALPHA urged the Ontario government to reconsider the cuts in the timelines and extensively consult ALPHA, AMO, and the City of Toronto before final decisions are made with respect to the governance, management, and administration of a regionalized public health system and the delivery of frontline public health programs and services. Moreover, ALPHA urged its members to meet with their local municipal officials and MPPs to make use of ALPHA's resources that were listed in the statement and to amplify and/or modulate the messages contained therein as members saw fit. Later on May 3, 2019, ALPHA wrote a letter on public health modernization to the Deputy Premier, and Minister of Health and Long-Term Care. The letter stated ALPHA supports public health modernization's goals of broader municipal engagement, more efficient service delivery, better alignments with the healthcare system, improved staff recruitment and retention, and improved public health protection and promotion. ALPHA's chief concern remains public health funding cuts, namely its members need specific information about their 2019-20 provincial grants, need coverage of any immediate local shortfalls, and need assurance that the total investment in public health does not increase over time. ALPHA eagerly anticipates more details about the plans to streamline Public Health Ontario, given that this agency is an essential partner to public health, especially with respect to evidence-informed decision-making locally. And finally, ALPHA welcomes a conversation about the status of the Ontario Public Health Standards, protocols, and guidelines if changes are being considered, and stresses the importance of an inclusive and reciprocal stakeholder conversation. Given the magnitude of the proposed changes in public health modernization, ambitious timelines, and disruptions they will cause, the letter concluded that attendant risks need to be mitigated and frontline public health professionals need to be supported locally and provincially in order for them to continue to carry out their duties during this time of transition. In addition to the above, ALPHA and its members have been successful in bringing attention to the public health funding cuts and proposed restructuring, have had a fulsome media presence here and across Ontario, and have been extremely active on social media. In closing, Alpha values and appreciates the work of all of its members in giving voice to their concerns about public health funding cuts and restructuring. Alpha stands ready to support its members in the days, weeks, and months ahead as regards the challenges, disruption, and turbulence posed by public health modernization. And with that, I'm happy to take your questions. Thanks, Chair.
Thank you. Any questions for Dr. Kyle? Sue Wong.
Thank you very much, Dr. Kyle, for coming back to the Board of Health. A couple of questions. I just read your letter to the minister, as well as your values from the Alpha. So is Alpha prepared to take on the responsibility to track an evaluation of this so-called modernization? Because somebody has to look at this whole, better word, modernization is cut. So is Alpha, as the provincial organization, looking towards evaluating this modernization of health units across the province?
So what I would say is this: we're driven by the preferences, requests, priorities of our members. So if our members want us to act as kind of a clearinghouse with respect to actual impacts on frontline public health services, to the extent that we have that capacity to do so, we're quite prepared to do that on behalf of our members.
Okay. The second question is, I recall the last question I asked you when you were here to the board, that you were not consulted as an organization about this so-called regionalized health units. So how did the government, or how did the ministry determine 10 regional health unit is best for the province? Do you have any idea how this number came to be?
I don't. You'd have to direct that to ministry officials.
Okay. And the last question is Alpha already anticipate some of the legislation or regulation changes? Because if you read between the lines that there is going to be relaxation or enforcement of certain public health standards that they're not going to be doing. Because you read between the lines that there is going to be changes to regulations and legislation to the act. So is Alpha leading the way in that conversation with the ministry to ensure that some of the critical changes to the regulations and legislation are not going to jeopardize the health of the whole province?
So let me answer it this way. Currently, our members are focused on the cuts,
Okay.
and they're focused on, if you will, the ambitious timelines and the risks associated with restructuring. I think we all have heard, or at least anticipate, that there's a fairly short runway between now and the fall, which seems to be the earliest opportunity to open up our governing legislation to, for example, establish regional public health entities. During that time, if our members wish us to play an active role in terms of providing input and otherwise shaping the legislation, we would be very prepared to do so. And was there a third question there?
That's it. Thank you.
Thank you.
Thank you, Sue. Any other questions? I just have a couple. So in your deputation, Dr. Kyle, you talked about these are in-year financial cuts in all public health units under the new model. Is that correct, as we understand it?
That's right.
Has the province provided details of there are 35 public health units being reduced to 10. Have they provided details on what those new 10 units are?
They may have, on a health unit by health unit basis, they're right now going through, I guess, preliminary conversations with public health units, primarily focused on what to expect in terms of their provincial grants for 2019-20. And if the draft regional configurations come up in that discussion, then that's happening at a local level. There's not been a master plan that I'm aware of that has mapped out the boundaries of the 10 regional entities.
So, as the president representing all public health agencies and units, you are not aware, we are not aware, certainly at the city, and certainly in the public, no one is aware of what those new 10 units will be.
That's correct.
So how can municipalities make in-year financial adjustments if they don't even know if their public health unit will exist or not?
Apart from Toronto, which, as you heard from Dr. Davila, will be one of the 10 regional public health entities, that's a good question. They won't know.
Okay. Those are all my questions. Thank you very much. Thank you, Dr. Kyle. Our next speaker is Carrie Davies. Carrie is the Vice Chair of the Peterborough Board of Health. Carrie, you can come forward, take a seat. You'll see Carrie to my right, the clock there. You'll have up to 5 minutes, and then generally friendly questions because you have a nice audience.
Thank you very much. I do apologize for my voice, but it's better than it was yesterday. So, as you've heard, my name is Carrie Davies, and I am the Vice Chair of the Board of Health for Peterborough Public Health. I'm a provincial appointee, and I'm serving in my 5th year. Peterborough Public Health serves an urban-rural population of approximately 135,000 people, made up of 9 municipalities, including the City of Peterborough, 7 townships in the County of Peterborough, and as well, we have the privilege of serving 2 First Nations, Curve Lake and Hiawatha First Nations, since 1995. I'm pleased to be here today to address the Board of Toronto Health and our guests here today to add our voice to the critical conversation about the preservation of public health in our province. I would first like to state that Peterborough Public Health echoes Alpha's support of the Minister of Health's proposed policy direction to maintain public health as closely connected to its municipal councils and funders. Ontario's communities need public health on the ground with them as accessible and responsive partners, so we're glad to hear this important relationship is being preserved. However, we are concerned about the planned download of public health funding to municipalities. We all know what happened the last time the province downloaded, and inquiries into both SARS and Walkerton called for greater, not less, provincial investment in a strong and local public health system. Peterborough's Board of Health supports a call for a delay in changing the provincial municipal funding formula until a comprehensive and thorough consultation with impacted municipalities and boards of health can be conducted. We need to ensure that there are no unintended consequences and that the final funding formula is both sustainable and optimal. Given that municipal and Board of Health budgets for 2019 have already been finalized, a change at this critical time will result in significant funding shortages and potential reduction in important public health service delivery. We're also concerned about Minister of Health Elliott's comments regarding Toronto Public Health in regard to bicycle lanes on Yonge Street. We know through experience that working with municipal partners to design healthier built, natural environments is just as much a core public health service as our immunizations and outbreak control. In fact, with 85% of Ontario deaths resulting from chronic disease like cancer, diabetes, and heart disease, healthy public health policy by Board of Health and their staff is none more critical in keeping Ontarians healthy and preventing hallway medicine. For every dollar invested in policy actions like building infrastructure for active transportation results, we reap high returns on investments. In policies that affect disease prevention, such as those limiting tobacco marketing, access to alcohol, and fluoridization of water, results could be almost double the median cost-benefit ratio of $8.30 return for every dollar invested in health programs. Benjamin Franklin had it right when he said, almost 300 years ago, that an ounce of prevention is worth a pound of cure. Finally, in support of Toronto Public Health, I want to point out that Peterborough recognizes that Toronto is our first line of defense against emerging diseases of public health significance. An outbreak may only be a plane, car, or train ride away. We need Toronto to be strong and well-resourced in order for smaller communities like ours to be fully protected. In addition, because of Toronto's size, its diversity, and its capacity, it is often the municipality that breaks new ground for public health. Bylaws protecting the health of communities often get developed and tested in Toronto and then spread across the province. For example, Toronto Public Health was the first to push for a ban on the cosmetic use of pesticides. More recently, Toronto Public Health is leading the charge to address vaccine hesitancy and calling on Health Canada to explore ways of stopping the spread of misinformation about vaccines. And Toronto bylaws often lead to provincial legislative changes as well. Toronto Public Health is a health leader and a resource for this province. We must be careful not to put this at risk. I'd just like to briefly recap in the last 30 seconds I have. We have been working closely with our local MP, and we met on Friday. We've asked for 3 things for him to champion for us. Number 1 is to work together for boundaries that make sense for Peterborough, including our rural and urban mix. We need consultation to understand the unique challenges of our rural community. Secondly, we would like to understand better how a 20% reduction will not result in the loss of services. If the province has a plan, we'd like to hear that. And thirdly, that new boards will include representation and a governance model that reflects our community and understands our needs. We must work together to ensure that Peterborough Public Health, and indeed public health across Ontario, is second to none. Thank you, and I'm open for questions.
Thank you. We'll now open it up for any questions people may have. Peter Wong.
Thank you for your deputation.
Thank you, Mr. Wong.
Peterborough Board of the area has the privilege of having 2 Indigenous populations within it. Has there been any discussion with regard to protecting the health of the most vulnerable populations, which are Indigenous people and children?
In this current
in this
proposed
current
modernization?
discussion? Correct.
Not that I'm aware of. And in fact, the chair of our Board of Health is a councillor of Hiawatha First Nation, and she certainly expressed no surprise at the lack of consultation in this process. She said they're quite used to that.
Thank you.
Thank you, Peter. Any other questions? Councillor Wong-Tam.
Yes, thank you very much, Mr. Chair. And with respect to perhaps the province's intentions with all these big announcements and very little detail to come, can you speculate, and I recognize that you won't necessarily have the full answer, but can you speculate on the true intentions of the province of why they're doing this beyond their public-facing claim that it's about looking for efficiencies?
I think there's a lot of people that would like to be able to have that crystal ball to understand what their intent is. I don't think we're surprised to see more downloading to the municipalities. I know that at the end of the day, there's only one taxpayer, so one way or the other, someone is going to be paying for this, and if we don't pay for it now, we're going to pay a heck of a lot later down the road. But as to their long-term intent, I don't know.
And with respect to the impacts of Toronto, I mean, obviously you recognize that the announcements and the funding formula for Toronto are going to change dramatically. I think that it was very good for us to hear, as someone who's not working in the city of Toronto, your perspective of Toronto's position and being the front line of defense. Can you tell me, like, is there a general understanding from other public health providers as well as other decision makers, including the ones who are MPPs outside of the city of Toronto? Do they recognize what is actually happening, and how can we convey that message more strongly?
It's a really good question. Do they recognize what's happening? I don't think so. I mean, we're only a few months past an election, so I would hope that part of the challenge with leading our MPPs to an understanding and hoping that they will rally for us is that many of them are new in their positions, and I'm certain with the councillors in this room, and we understand that you have a lot to wrap your head around. However, I don't think there's anything more critically important than the health of our communities, and they were elected on a mandate of ending hallway medicine. And I'm sitting here with the converted here, understanding the critical role in public health in doing just that we need to get upstream in order to be able to prevent people from finding their way to the hospitals. So if I could be hopeful in this, perhaps it is in the work that we can do in rural Ontario, in the bigger cities, in meeting with our MPPs and doing our best to help to educate them and to help them see that the invisible work that public health does, when it comes to light, when you learn what we do, it's oftentimes too late to reverse. So we just in closing, we had a Jane's Walk on Friday night in Peterborough to celebrate 130 years of public health, and we just walked down a number of city blocks, and we called our walk Making the Invisible Visible, and we went from doing food safety checks to our work with the youth, to our water that flows through our city. We used to have an abattoir that dumped into a little lake, and we had about 40 people with us. I think we need to, it would have been nice if our MPP had been with us that night.
Thank you very much.
Thank you. Any other questions from members of the board? I just have one, if that's all right, Carrie. We've spent a lot of time here in the city and at the Board of Health talking about the implication of these cuts in recent weeks, but we've been focused largely on an urban context. Can you give us an insight into the dynamics of potential public health cuts and the change in the number of units in a rural and urban consideration?
Well, I think the funding, first of all, would be the biggest challenge. We know that our First Nations can't afford any increases, and the municipal representatives that I've spoken to are very concerned about where they're going to find the funding. As you're probably aware, there appears to be some opportunities for municipalities to make discretionary decisions on perhaps not delivering some programs. We have no idea how that would work or how they would even be able to come to make such decisions. So that is certainly a concern. We have a lot of isolated older adults in our community, and I think that is going to be certainly of critical importance. We also have a significant opioid crisis in Peterborough. People are going to die. We need to be able to continue to have a safe downtown location where our community can come to, as well as reach out into our rural communities to take public health to where people live.
Okay. Thank you very much.
You're welcome. Thank you for the opportunity.
Thank you.
Good luck.
Thank you. To members of our board, I have a request here in the speaking order. We have a visiting deputant who has arrived, who has traveled and is traveling later. If we can move him up, if that's, people are comfortable? Yeah. All those in favor, opposed? All right. So next up, we have Dennis Doyle. Dennis is the mayor of Frontenac Islands and chair of the Kingston, Frontenac, and Lennox and Addington Board of Health, and of course has traveled to be here. So Dennis, you'll have 5 minutes, and there's a clock on my right. Over to you.
Thanks very much, Chair Cressy, and members of the Board of Health, and Dr. Davila. I'm very pleased that you and your staff and your mayor are strongly advocating for public health across Ontario. In addition to my responsibility as chair of the Public Health Board, I sit on the governance body for our local paramedic group, which covers the city of Kingston and Frontenac County. Our public health unit also covers a very large area from the islands at the east end of Lake Ontario, north through Kingston, Napanee, up to Bon Echo Park, and just south of the Algonquin Park. To get to the average of 1.4 million people needed in each of the proposed 10 regions, ours would likely run from the Haliburton-Peterborough area straight through the Quebec border. We work closely with health units on both sides, and if we combine the three of us, it does make some sense, and it would be relatively easy to do without disruption. But merging all the Eastern Ontario health units, it would cause unnecessary and unintended consequences. The new region would end up with well over 100 municipalities, and it would be impossible to have effective representation from the property taxpayers who will be paying for the service. Thus, we would have taxation without representation in both public health and in the paramedic service. There is only one taxpayer. The measures announced do not save taxes. They merely shift property taxes to the taxpayers. Our most immediate problem in the Kingston area is we now cover 11 municipalities, and our budget for 2019 was set in November 2018. So now that the rules of the game have changed, it's impossible to go back and ask for more money. The province froze their contribution to our public health unit for many years now, and we're currently at a 60-40 split already. So if we proceed with these terrible draconian measures, we'll be well over 50%. It could flip the other way, 60-40. I have already heard nothing from the province with reducing the current service levels for public health. So therefore, without significant cuts in staff and other drastic measures like closing our rural 3 or 4 satellite offices, we will be in big trouble in the Eastern, coupled with the proposed paramedic changes, which could result in closing small rural paramedic stations. We will end up with a lot of ghost towns across Eastern Ontario, as people simply won't want to live there with the reduction in service. Evidence shows that public health delivers an excellent return on investment. The levels of cut in the recent announced provincial budget will result in cuts in the frontline programs and staff. People will lose their jobs. We are aggressively working with on saving health system money and reducing hallway medicine through key public health actions, including vaccination, harm reduction services, and many more. Our rate of vaccination is 98.6, high enough to ensure herd immunity against illnesses such as measles. But we are very worried we will not be able to maintain this success without adequate funding. For every dollar invested in immunization, the public health care system saves 16 in cost. This reduces hallway medicine. We simply cannot afford to have another infectious outbreak like SARS or water contamination event like in Walkerman. These events kill Ontarians and cost us millions of dollars. To the government of Ontario, I say, you cannot be open for business if you aren't preventing illness and promoting good health. The Conference Board of Canada estimates SARS lowered GDP by $1.5 billion. Cuts in public health are not fiscally responsible. Investment in public health is. We are extremely worried about the upcoming flu season being very severe. Public health is essential to respond to any emerging infectious diseases such as Lyme disease, influenza, Ebola, etc. History tells us the next threat is just around the corner. We ask the province to please reconsider the funding cuts. Our hospital hallways cannot take the pressure, and our business cannot succeed in face of these threats. I can foresee many unintended consequences with the proposed changes to public health and the paramedic operations, and ask our provincial partners to sit down and discuss with us before finalizing these proposed changes. Thank you.
Thank you, Mayor Doyle. Questions? Sue Wong.
Thank you very much, Mr. Doyle, for being here today. I got 2 questions for you. First of all, have you presented what you presented to the board to your local MPPs, and what are the comments, if you have visited them?
Unfortunately, we haven't had an opportunity, and our main MPP is Randy Hillier, and it's a difficult situation there, because when he stood up to some of the things that the province was doing, we all know what happened to my friend Randy.
Okay. So my second question is that in your presentation, you made references to paramedic a number of times. So am I assuming that your health unit has some responsibility with paramedics.
It's not the health unit per se, but I also sit on the Frontenac County where I'm past warden, and we handle the paramedic service for the city of Kingston and the county. At the other side of the coin, the city of Kingston handles our social services and various other things. So we have quite a few partnerships in that regard. So, but we are very worried because a leaked paper shows that part of the paramedic change is cutting 300 ambulance vehicles. That's a lot of people, and that will result in a lot of people dying because we won't be able to get to the locations fast enough to save the person.
That's my next question is, what is going to be the response time that after this so-called modernization, better known as cut, in terms of responding to these 911 call? So does your paramedic services?
Well, within the city of Kingston, it may go from, say, 7 minutes to 7.5 or 8 minutes. The problem is in the outlying areas, in the community I live in, we're serviced by ferries only. So if you don't have a station on the island, you have to jockey the ferry back and forth, and the round trip is an hour. So, you know, instead of responding in 10 minutes or so, it could be well over an hour. So you know what happens if you've got a heart attack or a stroke.
Thank you. Thank you for being here.
You're welcome.
Yes, thank you very much. And Mayor, thank you very much for your comments and also for your ongoing strong advocacy. You mentioned that the amalgamated new health regional health center for your area could be in charge of 100 municipalities. Is that what I heard correct?
Yeah, so it'd probably be something like 120, I think. Just like Toronto, our impression is that Ottawa will be left alone. And we've got a group in Eastern Ontario called the Eastern's Warden Caucus, which is already a well-established, well-defined area. And that's why I say that I'm thinking that that's probably what they would like to do. The Eastern Warden Caucus doesn't include cities like Kingston, Brockville, Belleville, and so on, or Port Hope or Peterborough as far as that goes. But if they were included, it brings it up, I think, something like 1.2 million people in that district, which is roughly what they're looking for in each of the 10 regions.
Yeah, and obviously the municipalities, the local governments here are much more spread out. Accessing small populations in the towns will not be so straightforward.
Yes, they're very spread out from, I don't know how many thousands or hundreds of thousands of square kilometers in the region, but it's huge.
And unlike our previous speaker from Peterborough, which spoke about the urban and rural divide, Carrie spoke about that. The area that you'll be representing, will you also have the urban and rural divide?
Oh, for sure, yes. The city of Kingston itself is well over 100,000 people, yeah. But the rest of our current area is rural.
Okay. And Mayor, just I think for us who live and work in Toronto, oftentimes we have been a bit of the political football of Premier Ford, and so we're kind of used to things happening to the city of Toronto. And the Premier has stood up on numerous occasions that he's going to stand up for the little guy, the average guy. His government is for the people. What do you believe what would be the true motivation here? Because I'm trying to understand why. Why is this happening? And given the area that you represent and the deep connections that you have with a wide range of political actors out there, can you give us a sense of why this is happening and what the true intentions are for these cuts?
We've all been asking ourselves that same question, and we can only speculate why, but it seems that this government wants to have much tighter control on every aspect of what's going on in Ontario. So I guess our real worry is his next announcement will be to amalgamate all our small municipalities, which will then be much more difficult to have representation of the people. And the last go-around of amalgamations, nobody's been able to prove that there was a nickel saved across the province, so we're very worried.
Thank
More
you.
expensive here.
Here too, yeah.
Thank you, Mayor.
Yeah, thanks very much.
Any other questions? So I just have one. Mayor Doyle, so in Toronto, we're hearing from a range of constituencies with concerns. School boards, some of whom are represented here, doctors' associations, nurses' associations, but we're hearing about it in our communities. So are you hearing concern across the communities in Frontenac and Addington and Lennox? Is this permeating into the communities, the concerns?
It sure is. We work closely with the local hospitals and Queen's University in particular, and there's a great concern about this move.
Okay. Those are all my questions. Thank you very much, Mayor Doyle.
Thanks for your time.
Okay, our next speaker, and I apologize if I mispronounce the name, is Yazarni Wynn from the University of Toronto Faculty of Medicine. Was I close?
Yeah.
All right.
Got it.
So, can I say Dr. Wynn? Are you a doctor yet?
Not yet.
Not yet. All right. Just trying.
sometime soon.
You'll have 5 minutes, soon to be Dr. Wynn. You have a clock on my right.
Sure. Good morning. My name is Yazarni Wynn, and I'm a third-year medical student at the University of Toronto. I'm here to speak on behalf of over 90 medical students who have expressed concern about the initial decision by the provincial government to cut an estimated $1 billion to Toronto Public Health over the next decade. We have created and disseminated an open letter to our Minister of Health, Christine Elliott, last week regarding the cuts, and have managed to engage hundreds of views via social media. We are particularly vested in this issue because we are the future frontline of healthcare. We are the ones who will be taking care of patients soon to be subjected to the consequences of a debilitated public health system. I'm here today to tell you not about the statistics or the resulting losses of a $1 billion cut to public health in the next decade. These are numbers that you've already compiled and are probably well aware of already. I'm also sure that you're well aware that 28 mayors representing 67% of the Ontario population already stand with you. I'm here to convey a concern from a healthcare perspective and what these cuts mean for patients and for our clinical practice moving forward. Public health differs from healthcare in many different ways, but the two are intrinsically linked. The impact of a strong public health system largely goes unnoticed. However, a weakened and defunded public health system can lead to numerous and very real consequences, such as the emergence of measles and other infectious diseases, spikes in opioid overdoses, and deaths related to contaminated water. All of these issues have impacted our city in the recent past and will only exacerbate with a weakening public health system. As medical students, we're exposed to the patients at the brunt of these large policy decisions through our clinical rotations. One of the most heart-wrenching realizations as a healthcare provider is knowing that an illness or a death could have easily been prevented if the proper supports were in place to promote the health of the patient. This may mean a child with a new diagnosis of meningitis because of a lack of herd immunity from a weakened immunization program. Or it may mean a young man with a new diagnosis of HIV due to lack of accessibility to a test and treat clinic. As recently mentioned in a Toronto Star article by emergency physicians Dr. Shaikh and Dr. Venugopal, public health and emergency medicine are two sides of the same coin. Less supervised injection sites mean a spike in overdoses, particularly against our city's most marginalized citizens. Less food and water safety precautions, such as the water contamination crisis in Walkerton, Ontario in the year 2000, means an increase in acute diarrheal illnesses, particularly harmful for those already managing chronic illnesses. Less infectious disease surveillance means an even further increase in the number of measles cases amongst children in Toronto and in our GTA. And less emergency preparedness means an even bigger outbreak and death toll the next time our city is threatened by the next pandemic, such as SARS or H1N1. These cuts will exacerbate the demand on emergency departments, hospital wards, and will reinforce rather than relieve the practice of hallway medicine in our city and in our province. We speak to you today not only out of obligation as future physicians to advocate for health, but also because, simply put, we are afraid for our future patients and for our loved ones who live in Toronto. These are easily preventable, but incredibly difficult to treat conditions that will only become more common with an underfunded public health system. We're scared for the citizens of our city who are already marginalized, who will be further disadvantaged due to lack of health protection that they deserve as human beings. We're also scared for the children who will be denied access to the services needed to promote their health as they grow and move towards tomorrow's adult population. In summary, the cuts to public health will relieve short-term debts at the cost of intergenerational, downstream poor health consequences for our city's population. Today, we are urging the Board of Health to continue pushing back against the provincial government in order to protect the health and safety of our city. We ask that you demand transparency and clarification from our Premier and Minister of Health as to the rationale to these cuts and how the provincial funding of healthcare plans on paying for the repercussions of these cuts, knowing that for every $1 invested in public health, $16 in healthcare is saved in the future. This may seem like an effort to preach to the choir, but from a healthcare perspective, we cannot stress enough the importance of protecting our city. We stand with the Board of Health and will continue to advocate for health protection of our city at an institutional level, but we also hope that you continue supporting our grassroots initiatives and that you elevate our concern to the provincial government. Thank you.
Thank you very much. Questions for soon-to-be Dr. Wynne? Councillor McKelvey.
Hi. Firstly, I just want to thank you for coming in because I know scientists and medical students tend not to be political by nature, and I think it's very important what you're doing, so thank you for that. My question is, as you're going through medical school, how important is the preventative health aspects? How much is that stressed in your coursework and in your practicums, for example?
Definitely. So I'm a third-year student right now, and this entire year is rotating through various clinical specialties. So I've already had the opportunity to go through my family medicine rotation and recently my emergency medicine rotation. And kind of connecting those pieces together, you can really see a lot of the gaps in care. In particular, during my emergency medicine rotation, I rotated through Toronto General Hospital and Toronto Western Hospital. And in that experience, I saw numerous patients coming in with complications related to transplants or chronic illnesses or cancer patients that required emergency services. And in the same emergency department, I saw patients coming in with intoxication who have no fixed address or who are coming in with fentanyl overdoses. So you really see such a range of very preventable illnesses that unfortunately the emergency departments in our city aren't able to fully address all at once when all these demands are happening at once. And I think connecting it back to more of a primary care family medicine perspective, it's so much more important, not so much more important, but it's just as important to invest in public health to make sure that a lot of these illnesses aren't exacerbated to the point that people are showing up to the emergency department with either critical illness or acute illness.
So as a soon-to-be doctor, do you think that instead of cuts to public health, we should be investing more in public health?
Definitely. I would definitely agree with that. And I think historically it has shown that any investment in public health results in greater returns in healthcare later on. I think just given the climate that we're in right now, it's really important to protect what we've already had in place and then hopefully eventually moving forward increase our investments in public health.
Thank you, Councillor. Any other questions? Councillor Wong-Tam.
Yes, thank you very much for your very powerful deputation. I want to ask, if I may, I think we might as well just have an honest conversation, because that's how we operate here. We are, as I read your deputation and as I also just sort of think about the words that you said, you asked us to push back, to continue to stand strong, to demand transparency, and to just keep advocating and to help elevate your voices and your concerns and the concerns of your colleagues here. We have been doing that. I think you could probably recognize that through the chair and Dr. Davila, through the mayor, and obviously even our out-of-town speakers today, there is this rising opposition. But it doesn't seem to, so far, have too much effect yet at Queen's Park. What do you think we need to do next?
It's a good question and a very difficult question. And I didn't mean to undermine any of your work in any way.
And we never took it. I know I didn't take it as that, but I'm just trying to understand what next needs to happen.
Sure. I think with the continued pushback, I think it is very important to have the patient experience kind of threaded throughout all these discussions about funding and costs. I think all of those are very important considerations, and I think on the minds of everyone in this room and also in the oppositional government. But I think what might really try and sway people is the actual impact that it has on patients and how it's impacted patients so far, and how we may project that it may impact so many more patients in the future, which I think we can all agree that we're collectively worried about. I think all of us are worried about health in different ways, and we all have different strategies that we think might be beneficial in the future, but I think going back to our communities, going back to the patients, and having them speak on our behalf as well is a really important step moving forward.
And is that what you're doing with your colleagues, with the doctors in training, as you speak to your patients as well?
I think moving forward, that's definitely something that we would want to continue including in our advocacy efforts as well. I think as a preliminary step, this was very much from the voice of a medical student and kind of our experiences so far, but I think moving forward, it would definitely be important on our end to also include patient voices as well.
And then that means the City of Toronto must also engage in awareness and to sort of ask the residents of Toronto to rise with us. So it's not necessarily the same talkers and the same talking heads all the time. Like residents of Toronto need to engage with their MPPs to call the Premier. That's what is really required, this wider public education campaign.
Completely, yeah. And I think it's our job and also everyone's job here to continue educating the public as well, because again, a lot of people may be neutral on the issue currently, but again, by hearing the patient voices, hearing about what our concerns are for the future, there might be a really good opportunity to sway a lot of those voices.
Okay, thank you very much.
Thank you.
Thank you, Councillor. Dr. Wong.
Thank you, almost Dr. Wynn. And thank you for the advocacy that you are providing and all the medical students with you. And we know that the foundation of our medical curriculum is based on community health. And we know that people in medical school that choose public health as a career are very special doctors. How do you think these cuts and these reduced number of units are going to affect medical students' career choices with regard to public health?
Sure. I can't speak completely on kind of career decision-making on behalf of all of my colleagues. I know that from my limited understanding of the public health residency, that every year there is an increasing interest, not just in public health as a medical specialty, but also generally in primary care as well. And I think this has been a growing trend over many years. I'm not exactly sure how these cuts are going to affect our decisions kind of from an institutional level in terms of the careers that we decide to go in. But I know that there has been an increasing trend towards primary care specialties and preventative medicine in the past few years and decades. And I really hope that continues as well, because I think we can all agree that it's one thing to kind of treat illnesses once they happen, but it may be a more effective decision to kind of treat them before they happen and try and address those problems beforehand.
Thank you, Dr. Wong. Any other questions? I only have one. Most of it's been asked already. Next year, you will, I imagine, choose your residency and specialty?
Yes. Yeah.
All right. Just putting a plug in for public health and preventative medicine here. That's all. Just putting a plug in. Thank you very much.
Thank you.
Soon to be Dr. Wynn.
And thank you for my colleagues for joining me here today, too.
And to the other medical students who've joined us here. Our next speaker is Rachel Gray from the Stop Community Food Center and the Food Policy Council. Rachel, you know it well. When you're ready, you'll have 5 minutes.
Thank you. Good morning. As the chair has said, I'm here on behalf of the Stop Community Food Center and also the Toronto Food Policy Council. A group of about 30 volunteers who work to bring the issues of food to City Hall and to bring the issues of governance on food to communities. The membership of the TFPC is very diverse. We are academics and farmers. We are small business owners, restaurant owners, community workers. It is a broad and very complex group of people that reflect the complex food system that we are trying to navigate and bring to City Hall. It also, I would say, is a body that is part of a legacy over almost 30 years of a food policy council that is renowned around the world for having brought that level of engagement, democratic engagement on food to City Hall. And often we are visited by other food policy councils who come to Toronto to understand how we make food so vibrant here. The role of elevating and advising the Board of Health on food is critical. It's part of that complexity. It's part of the value that is, I think, mirrored and what I think is true is that members of the Toronto Food Policy Council appreciate the complexity of Toronto public health because of their experience within the food system. But I come today and I don't want to talk about food issues, if that's all right. I will talk broadly about public health. I will leave aside for the time being the potential loss of 210,000 meals for children in this city because of the proposed budget cuts. I'll leave aside the issue of inspections in restaurants, remembering how important restaurants are to the economy of this city. I won't speak about the good food markets, the mobile good food markets that bring food to neighborhoods where food is not easily accessed, especially healthy, good food. And I won't talk about the Community Food Works project, which is both a strategy for integrating newcomers and a workforce development project that has seen great success here in the city. I won't be talking about food because public health is both wide and diverse and needs to be understood in that context. It is, as many have referred to, invisible, intricate, and critical if the city and the province are to thrive. Since 1883, when the very first medical officer of health was appointed here in Toronto, the Toronto Public Health has provided deliberate, thoughtful, data-driven decisions to help inform public health. And that has resulted in a system that has been built for this city. A system that believes that if we want to have healthy communities, we start with healthy babies and we have healthy, well-fed students. It believes that we look at a whole system of health and support systems and responses that are going to collectively address all of our well-being. While the Toronto Food Policy Council has not had a chance to meet yet, we will be meeting on Wednesday and we'll be voting on a motion to support the Board of Health and to call for the reversal of these cuts because we believe there really is a tremendous amount at risk. Toronto is a very young city. When the first medical officer of health was appointed, these lands right here were referred to as the ward. They were slums, and the medical officer of health was working through issues like typhoid and smallpox. Through deliberate reform and education over close to 150 years, we now have a well-regarded system that keeps us well, that appreciates that children will do better if, for example, they're able to learn in classrooms and not worry about being hungry. We know that our provincial economy and our city economy will do better if we're not navigating things like SARS and Walkerton. I would say oftentimes my children tease me about the fact that I have 2 degrees in history and yet work in the community social services sector, and they often say, why did you ever bother? I will be very sure to tell them today that at the Toronto Board of Health, time after time, history was referenced. And I believe that more than anything, we need to look at the history of this city immediately around here to reach out to others across the province who recognize that history teaches us that we cannot live without the system of public health and must not only call for the reversal of the cuts, but increased support for public health units across the province. Thank you.
Thank you, Rachel. Questions for Rachel? Seeing none. Thank you. Are there any other speakers here to depute on this item? I have no more registered to speak. One more. Come forward. Oh, it's Lynn Raskin. Lynn, you can come forward. We'll have you register with the clerks afterwards. And I'll let you, as we don't have you listed on the list, Jason, come on and join us. I'll let you introduce yourselves, and you'll have 5 minutes, and you know the drill.
Okay, excuse me, thank you. I actually thought we were on the list, but that's okay. Here we are. So thank you for inviting us, and it actually is a great honor to be here and speak on behalf of the relationship between Toronto Public Health specifically, but public health generally, and community health centers. So all of the information that was shared before is actually rests within the context of CHCs. Jason and I come from South Riverdale Community Health Center. There's 73 of us in the province, and all of us work closely with public health. I would say that Toronto Public Health has been a leader in many ways that we have benefited by, as have our clients. So South Riverdale Community Health Center is located in Southeast Toronto, and we work with the people that the soon-to-be Dr. Wynne is talking about in terms of marginalized communities. South Riverdale works with about 11,000 clients, and these are folks that really are marginalized and have access to some things but not everything, and that's in a system that actually has been well resourced comparatively to get primary care, for example, specialist care, and to actually consider healthy communities. So we are here actually to connect our work and put a face on the few issues that we work with public health on, and without public health to support us, we would not be able to do this work. So this is really in the trench work. I'm going to talk about harm reduction to begin with. And Toronto Public Health supplies us with the supplies that we distribute to public health. And in the last year, just to quantify this, we distributed 400,000 needles, syringes, and other supplies in the east part of the city. They also support our mobile outreach services. And I just want to reflect on a little bit of history in terms of AIDS. And it was during the AIDS epidemic that public health was able to prevent the spread of AIDS through the distribution of these supplies. Today, HIV and AIDS and other infectious diseases are, in fact, improving because of public health. So it is not HIV and AIDS, as we know, has not been eradicated, but things have been improving because of public health and their vigilance and distribution and engagement with community. It's now hepatitis C that we're concerned about in the same population, drug-using population. And in Toronto, we actually have the lowest rate of hepatitis C, and that's because of the early adoption of Toronto Public Health to support us in the distribution to eradicate hepatitis C and address the prevalence. It's interesting that a government that has actually now launched or approved community treatment teams, in spite of the numbers of overdoses, is now limiting those and actually looking at ways to potentially reduce the distribution of supplies. So it feels, we're very pleased that we actually have those services that have been approved, but to date we actually have no more detail on what that actually means, and there's been a request to increase them. With Toronto Public Health support and leadership in harm reduction, we have been able to actually gain the attention of this current government. I want to actually talk about numbers. I think we've all talked about the overdose crisis and our responsibility in addressing that and the role of public health to assist us. In Toronto, since last October, there have been 10.7 thousand people that have gone to hospital as a result of overdoses. 2,000 deaths were related to overdose crisis, and over 600 Ontarians died of an overdose in the first 6 months in 2018. So generally, there's an increase in overdoses, there is an increase in hospital visits, and there's an increase in overdose deaths. These deaths will continue to rise if we don't do more to prevent them. And the question has been asked, what do we do about this? What we do about this is we actually enhance the work of public health. This also increases hallway medicine, so it's no way to address the issues that they have put on the table, and they've also, no one has discussed yet, what they have announced is looking at mental health and addictions as some of the priorities that they have highlighted, and this falls within the purview of that priority, and it seems odd that this is not being acknowledged as a current need. The other, one of the other programs that we work with public health on is postpartum depression. We've talked about kids, we've talked about women, we've talked about people with lived experience, and the public health postpartum adjustment program that we do with public health, Michael Garron Hospital, and others is something we will not be able to do if public health is not funded to do so. This, we all know, in fact, that this is not something that speaks only to marginalized communities, but also to the general community. So there are concerns that we have that affect our community in general. It also lays within the purview of mental health.
Lynn, you're just coming up on 6 minutes. I'm going to ask you to try and wrap up in a...
I'm going to actually wrap up.
Okay.
Let me get to my conclusion. I think the role of community health centers is critical in terms of working upstream, as Dr. Davila has always advocated. Community health centers also work with marginalized communities, and the work we do in concert with public health is extremely important, keeping people well before they go to hospital and use other parts of the healthcare system. And only a public health system that is strong will be able to do that.
Thank you. Questions for Lynn Raskin? Okay, seeing none, thank you.
Welcome.
Thank you. We're now, oh, sorry, Jason, were you also planning to speak? Were you giving a deputation too? My apologies.
No, not at all. I was actually prepared to answer questions if there were.
Okay. Okay. Thank you. So we're now going to move this in committee. So at this time, for members of the board, questions of staff. I'll start with Councillor McKelvey.
Thank you, Mr. Chair. Looking through your annual report, you break down the immense return on investment that you have in different areas, ranging from immunization, for every dollar spent saves 16, fluoridation, for every dollar spent saves $38. So in general, these savings, though, they're not borne to us, to the city. Those savings are borne to the province, right? Could you just walk us through that a little bit?
So through the chair, given that public health funding is right now a shared responsibility, there is a bit for both of us. So there is some savings that I think accrues to both provincial partners and municipal partners. But I think at the end of the day, what we're talking about, we can talk about return on investment, and you've highlighted, Councillor, some of the issues. But at the end of the day, these are investments in our people and in our communities. And we know that whether we're talking about savings to the healthcare system, both savings today and savings in the future, or whether we're talking about ensuring that we have healthy, thriving communities that actually allow for, one, to be attractive to business, and two, to have a robust economy. These are all investments at the end of the day that support, whether it's healthcare or other elements of the economy, other sectors. These are important investments, and they are cost savings.
So in addition to potential cuts to programs and services, as your budget constricts, does it also make you less nimble and able to respond to new or emerging issues? Like, does it put a kind of pressure on you on beyond just the services you have, but also just in terms of like forward-thinking, planning, and being more nimble as an agency to respond?
So through the chair, simply yes. Every program, and that includes being prepared for and being able to respond to emerging issues, outbreaks, and other emergencies. Those programs, plus every other program that we've described that we engage in, whether it has to do with food and nutrition, infectious diseases, early childhood development, every single one of our programs is affected by these kinds of funding changes that are being proposed.
Okay, thank you.
Thank you. Next up, I have Sue Wong, and then Councillor Wong-Tam, and then Councillor Lai.
Thank you very much, Mr. Chair. So, Dr. Davila, your presentation, I want to go back on, I think, slide number 2, talks about the $90 million of investment for this budget, deals with the new dental program. So what does that mean, translation to the City of Toronto? How much is that $90 million to the City of Toronto, and how much would that you anticipate will be for Toronto Public Health?
So through the chair, at this stage of the game, I don't have details that I can share with you in respect of this particular program. What we have right now is that there's approximately $90 million pool for a low-income seniors dental program. This is from the budget document. However, the specific details have yet to be provided to local public health organizations.
Okay, so thank you for that. The other question is, so am I assuming on slide number 3 that all the 100% funded program starting this year, we're going to be going to split with the province? Like, can you elaborate further? Which program right now by the province that they're funding 100% to Toronto Public Health, and that we're immediately, because this is 2019, that we have to cough up 40% to deal with these programs? Because what does that really mean the nuts and bolts for the people of Toronto?
So at this stage of the game, we have a number of programs, and you're quite right that we have a number of programs that are currently cost-shared, 75-25, and a number of programs that are currently funded at 100% provincial level.
Yeah.
And with this announcement, you're right, that the province has indicated that moving to the changed cost-sharing model applies also to those 100% provincially funded programs. There are roughly right now about $18 million in 100% provincially funded programs that are received at Toronto Public Health. And they cover a wide variety of different programs, largely under the Smoke-Free Ontario Act. There are Healthy Smiles Ontario, which is a dental program, prevention and treatment that's provided to low-income children. And there are some infectious disease, infection control initiatives. Those make up the bulk of the 100% provincial funding programs right now. So the interesting thing is that as we move forward, right, and given the proposed funding changes, it doesn't necessarily, it changes the nature of the pool that we have available to us to fund programs at Toronto Public Health. I don't think that it's appropriate at this point in time, until we actually understand the details, which we have yet to receive, to start commenting specifically on what programs and what specific implications it has on Toronto Public Health and therefore to the people of Toronto. But I can tell you that that's what's in the current bucket, if you will, of 100% provincially funded programs.
Thank you.
Thank you. Next, we have Councillor Lai. Or Councillor Wong-Tam.
Thank you very much. I just want to have a fuller understanding about the, I mean, obviously, we don't have the details. You're looking for details. The province has indicated that they're going to individually communicate with each individual public health unit about their concerns. There's a timeline to change all the funding moving forward. I mean, obviously, some of it is retroactive. Some of it is moving forward in 20, and the model of governance is changing in 2020. How can they get this done? We're halfway through the year, just about.
So through the chair, I don't think there's anybody in this room who wants to answer that question more than me. But unfortunately, I think until we get the details, it is impossible to really be able to plan and to talk about what the substantive implications are and what this looks like on the ground.
What happens if we don't get those details? So therefore, all we have is the announcement that we're all responding to, but no details are forthcoming. Do they need to pass legislation to change this? Or is this just by way of announcement, a decree that we're just going to change the way we do business? And do we have contracts, and I'm assuming we must have contracts in writing around the funding formula and how the allocations are. What do we need here?
So through the chair, in respect of the funding changes, from a physician perspective, and I would defer to my legal colleagues who are probably better versed in respect of what the legislation prescribes. But I would say to you that the funding changes can occur at the provincial behest. The governance changes I described would require legislation to be introduced and would require, follow-up activities related to that.
Okay, thank you. And I get the sense from the province that because Toronto, I mean, there's a lot of uncertainty going from 35 units to 10 units, but Toronto's definitely going to have its own regional Toronto Public Health Unit that we should be covered, and somehow there's some safe ground there. How would you interpret that?
So through the chair, what we have been advised through the various teleconferences that have occurred, and with the details or the information, let's say not particularly detailed, but the information we've received to date suggests that the plan includes a Toronto Regional Public Health Entity, and that's about as far as we've gotten.
Okay, so nothing more?
Nothing further.
Okay, thank you very much.
Thank you, Councillor. Councillor Lai, and then I have Councillor Perks.
Thank you, Mr. Chair. For the post-announcement provincial budget for you, Dr. De Vella, Has there been any conversation with the province? Like, I mean, did they invite us to talk to them and communicate to them on any kind of these things, that shortfall that we have? Were there any conversation with the province on this, or just a one-sided thing that they wanted to cut and that's it?
So through the chair, we actually haven't had the opportunity to engage in what I would characterize as real conversation. What we have had is some information, very high level, without an opportunity to really dig into the details. That just hasn't been provided yet. What we have had is, again, this very high-level information provided, but not yet the opportunity to engage in very specific, very locally focused, with details on numbers and programs. That kind of conversation has not really happened yet. But we look very much forward to having that conversation so we can understand what we're working with and actually make appropriate plans so that we're best able to protect the health and promote the health of the people of this city.
Since that conversation is not happening, have we actually requested them? Have we asked for that conversation with them?
Through the chair, we've made that request on a number of occasions. My understanding is that the conversations are happening, they're starting to happen, but there is much more by way of detail that's actually required.
We actually, for each councillor, we receive what specific, what's going to affect our ward and all that, with different wards, all these childcare inspection program cuts and student nutrition program cuts and all the school immunization and all those public health issues that is going to be cut. My question is that this cut is retroactive till the beginning of the year, is that correct?
So through the chair, the funding changes are indeed retroactive. However, the list that's provided is not necessarily a list of cuts. It's a list of the programs that are provided on a ward-by-ward basis by Toronto Public Health to give councillors a sense as to what programs are at risk, given the current proposals by the provincial government.
Further to that question, so does it mean that if we don't have enough budget, that means these, going forward, some of these services have to be cut, obviously?
So through the chair, given the nature and the size of the proposed changes, the impact is significant. So, those would be the programs from which we would have to consider how do we actually live within this new funding envelope as it's been given to us.
Further to that, are there any reserves on the budget or anything to cover some of these shortfall in the event that we don't get the funding from the province?
So through the chair, there is not a specific Toronto Public Health reserves per se. However, I will leave it to you as the board and to the wisdom of council to reflect on that opportunities that are available.
Thank you. These are my questions.
Thank you, Councillor Lai. Councillor Perks.
So I want to dig a little bit into this issue of the new governance model. So we have a variety of entities in the City of Toronto that have provincial and municipal roles both. We have the Police Service Board, say the Ontario Municipal Board, and Public Health, Toronto Public Library. Each of them have very different sort of governance arrangements. I'm wondering if you've been given any indication of what the new Board of Health arrangement might be.
Through the chair, other than the fact that the intent is to have autonomous boards of health, and I quote, with strong municipal and provincial representation, and that those boards are to be created by 2020, 2021, I have no further information.
So I find it interesting that strong provincial representation currently, if I understand correctly, everyone here is either a municipal official or was appointed by the municipal government. So it would be a new thing to have provincial representation here.
Through the chair for Toronto Public Health and for the Board of Health of Toronto, yes.
So conceivably, there could be majority provincial representation in the provincial government, and the provincial government could take over the decision-making about how these local services are delivered.
So through the chair, without the details, I suppose that's a possibility. But again, I look forward to hearing some of those details.
Okay, thank you.
Thank you, Councillor Perks. Councillor Layton.
Yes, thank you very much. In looking at one of the other items actually later in the agenda, it lists some of these fee-for-service contracts that we have that are 100% provincially, currently 100% provincially funded. Those are the type of programs that have been outlined that would switch to a 75-25 cost share arrangement?
Through the chair, yes. All 100% provincially funded programs, we've been told, will switch to a cost-shared model, and for 2019-2020, it's a 60-40 split.
So the blind, low vision early intervention program and the infant hearing program, they're kind of looped together.
So, sorry, through the chair, the funding changes that have been announced thus far are specific to Ministry of Health and Long-Term Care funded programs. Those programs that you speak of are actually funded through a different ministry, and we've heard that we've heard nothing different in respect of the current funding model on those.
So are any of those contract for service programs?
So let me just take a look and make sure I know which programs we've got there. Those are
The food, the mobile
100%
good food
province.
market, the dental care, the sexual health services.
So the top four, so on Appendix A of that list you're looking at, those are not funded through the Ministry of Health and Long-Term Care and therefore not subject to the discussion we're having at this point in
Which ministry funds those programs?
That is the Ministry of Children, Community and Social Services, formerly Ministry of Children and Youth Services.
Okay, thank you.
Thank you, Councillor Late. Any other questions? Trustee Donaldson.
Thank you, Chair. I'm looking on the slide that speaks to the mitigation strategy. And I know that you said you don't have any details yet about the exceptions and waivers, but can you describe, so as I understand it, the minimum standards for public health are prescribed in provincial legislation?
So, in fact, what's in the legislation is a reference to guidelines that local public health would be accountable for. However, the standards themselves are not part of the legislation, they're referred to in the legislation.
So these public health standards are Toronto public health standards?
So, no, in fact, they're Ontario public health standards with associated protocols, and the expectation is that local public health units will deliver on those.
And what are some examples of those standards?
So the standards cover the full range of public health practice, everything from surveillance and health status assessment, the diagnosis, if you will, of the health status of a community, through to early child development and child health and development programs, to infectious disease case management, prevention and control, to healthy environments. It's the full gamut of public health practice is covered through those various standards and protocols.
And the information that you have about the fact that one of the strategies that's being considered as exception or waivers is directly from the province?
Through the chair, that's correct.
So what would it look like to have an exception or a waiver to one of those standards?
Through the chair, I'm looking forward to hearing from the province what they have in mind.
Thank you.
Thank you. Any other questions from the board? All right, I have just a few. Dr. Davila, based on the provided details in the new cost-sharing model, what is the dollar cut to Toronto Public Health this year, next year, and on a go-forward basis?
So if I can, through you, Mr. Chair, if you refer to slide 5 in the presentation, it gives you the pictorial representation of what we expect this year. So we did have, and again, it's premised on the assumptions as outlined, on the 2018 allocation, the 2019 city-approved budget, and an effective start date for changes of April 1st. So in fact, what we're looking at is a total funding envelope of about a little over $190 million, given that we're changing from a 75-25 model to a 60-40 model, effective April 1st. Again, it depends on how you look at it. Either you look at it as a $25 million further investment over and above that which the city had planned for and its budget is required for 2019, or if the city cannot come up to to provide any additional funding, we're talking about roughly a $65 million hole. Going forward, it gets a little challenging to determine what's happening because, as I tried to mention, we know that there's an intent to move to regional models and that there's an intent expressed to reduce the funding envelope to effect annual cost savings of $200 million. So if we presume that the total funding envelope doesn't change to Toronto Public Health, you end up with a certain projection in terms of dollars lost to Toronto Public Health. However, I think we have to imagine that if regionalization is going to result in a $200 million annual savings, the new governance model and the reduction from 35 local public health units to 10 is to have a savings, surely Toronto would be part of that. To what tune, I don't know. So it becomes difficult to predict the future.
But just, if I can just be really specific with the numbers. This year, based on what is being provided to us at this time, the province would be providing us $65 million fewer dollars.
That's correct, assuming the city cannot add more dollars.
Understood. Next year on this model,
In the range of about $85 million.
85 million fewer dollars from the province if the city can't provide more. And the year after?
The year after that, I'm just going to refer to my colleague. It's a little over 100 if I've got it, or about 100, $107 million if I remember correctly.
102 for that year, and then every subsequent year afterwards, the 107.
Okay, so let me just make sure I have all of this. Based on what we know and what we've been provided, if the city does not contribute more, we have a $65 million cut this year, an $85 million cut next year, $102 million the year after, and on a go-forward basis, $107 million thereafter. Is that accurate?
Yes.
Okay.
Given the current numbers we have.
Okay. And just to confirm, the in-year cost, the in-year cut this year is retroactive, effective April 1. Is that right?
That's correct.
Okay. Can Toronto Public Health find upwards of $64 million in savings this year without cutting programs?
No.
Okay. Building on Councillor Perk's comments, the proposed new regional model, so currently, Toronto Public Health is accountable to the city and appointed, the members of the Board of Health are appointed by the City of Toronto. Is that correct?
That's correct.
And so you report to the Board of Health?
I do.
Under the new model, we do not know if the province will appoint some or all of the new members of the Board of Health. Is that correct?
That's correct.
So the province has said that they are empowering municipalities by cutting funding on us, but they're also empowering municipalities by perhaps taking away our local governance?
I will leave it to the province to discuss their intents.
Okay. Is Ontario the only province in Canada that doesn't fund public health to the tune of 100%?
Yes.
All right. Prior to SARS and Walkerton, what percentage was cost shared between cities and the province for public health?
Well, there's been some variability, but immediately before Walkerton and SARS, the funding was set at about 50-50.
And in the wake of Walkerton and SARS, it was increased. Why?
It was increased in recognition of the importance of public health and the desire to ensure that coverage and important public health services were provided across the province in a more consistent and standardized way. So from it was 2004, 2005, the province increased its investment over a 3-year period of time to that 75-25 level.
Okay. Thank you very much. We're now going to take this into committee for speakers. To speak, Sue Wong.
Next week, we have a budget subcommittee meeting, so I think we need to drill down some more, Mr. Chair, what Dr. DeVilla presentation today, because I think my main concern is not just this year's unfunded $65 million, but they're going forward, they're over $100 million and its impact to the system, but also programs and services. So I'm going to reserve my comments, but I think I believe next week's budget meeting, we need to have a very robust conversation with staff. What does this really mean? What is plan B, C, and D, if there is any? And doing some really critical moving forward basis, because not just about the budget, the governance issue we hear, the word Toronto Regional Health Unit, This may not be just the City of Toronto, my friends. It may be GTHA, because we have seen the word Toronto bantering around the board all the time. So it may not be exclusively the City of Toronto Regional Health Unit, but will be including the other Toronto area, our neighbors. I'm not saying we don't include our neighbors in our conversations, but having said that, I think we need to look at what does this really, really mean, Mr. Chair? But more importantly, we need to anticipate and plan, because this is not helpful for us. We have a lot of dark lenses out there, but we need to start anticipating the changes coming forward. So thank you for this comments.
Thank you, Sue. Next up, I have Dr. Wong. Peter Wong.
Thank you, Mr. Chair. In the provincial government's proposed funding model to modernize, streamline, and be more responsive to the health of all Ontarians, it's really hard to imagine how these significant cuts will not impact or worsen the health of the citizens of Toronto, but all Ontarians. We know that public health really works to keep the health of communities and families strong. I am particularly concerned about the health of our most vulnerable populations, specifically children. And we know that from statistics that every dollar invested in immunizing children saves many more dollars, $16 in the healthcare system. Every dollar invested in early childhood development will save $9 in social and health programs. So I am very concerned that these diminished programs, especially for our youth and children, will result in erosion of the significant gains we've made in many areas in nutrition, oral health, and immunization. So I am in support of the motions because I think that these public health funding model and cuts will certainly widen and not reduce health inequities, particularly among our most vulnerable populations. Thank you.
Thank you, Dr. Wong. Thank you, Peter. Next, I have Ashna and then Councillor Wong-Tam.
Thank you, Mr. Chair. I had two comments. I think Councillor McKelvey's left, but I did want to speak a little bit about the role of medical education and public health. So as a medical educator at University of Toronto, I'm very, very proud that you guys are here and representing the medical students and being advocates and speaking loudly and proudly for your future patients. Very reassuring as a medical educator. So just to speak a little bit about what's taught in medical school. 3 years ago, University of Toronto overhauled, well, I shouldn't say overhauled, but changed and updated their medical curriculum, mainly the first 2 years, and you are basically the first iteration who made it through those changes. One thing that was brought to light was public health was introduced as a theme, and a theme that needed to have importance and prominence throughout all 4 years of training. And so public health and preventative health is something that's introduced from day one of medical school. And that's done in theory for the first 2 years, and then for the subsequent 2 years, as students are going through their clinical rotations, these are being reinforced in practice. And that's everything, as you said, from primary care all the way up to tertiary care. And the other piece I talked about was advocacy. So students are taught values, medical values that are coined the CAN-MED roles. And one of those CAN-MED roles is to be an advocate. And that's what you guys have been today. And I hope you continue to be advocates for your patients in the future. So that's the education piece. The other piece is, as a primary care provider here in downtown Toronto, my main patient population are newcomers and refugees to the city. And part of the orientation that we do for newcomers is explaining to them how the Ontario health system works and how to access care. And Toronto Public Health is the foundation of that, and our patients are are taught and instructed on the role that Toronto public healthcare programs actually enhance their health. Some have actually come to see me very afraid in the last couple of weeks of how these cuts are going to impact the access that they have. So dental is the main one, vaccination, administration catch-up, surveillance are the other. The prenatal programs. So I think those are the three programs that we can't really, as a provider, I can't really tell my patients not to worry that they won't have access to these programs. And again, I don't have a contingency plan for them to provide those services elsewhere to the degree that Toronto Public Health provides them now. In terms of other vulnerable populations, again, over the last weeks to months, the changes to the safe injection site programs, high-risk patients, HIV patients, commercial sex worker patients, again, who are part of existing programs with Toronto Public Health, have expressed concerns about what their future is going to be like. And as a provider, I'm quite concerned because we collaborate with Toronto Public Health every day. And if we don't have that support, I'm afraid of what the implications, those implications will have as a primary care provider if we don't have other resources to fill in those gaps, which I'm not optimistic for.
Thank you, Ashna. Councillor Wong-Tam.
Yes, thank you very much, Mr. Chair. I had asked the question, why? Why is this happening to a number of the speakers, and what is the province's true intentions with these big announcements around efficiencies and asking the City of Toronto and now much of Ontario healthcare providers, public health care providers, to sort of do more with less? And I think that the answer that's now coming to light, and I think that we're seeing this with the other big announcements, quite honestly, whether it's the upload of the subway or the reduction of the gas tax, bringing back the Ontario Municipal Board and the elimination of funding to housing, all of this is about taking power from local communities and local governments and local decision makers. And so if we were to get to the why and the true why, because we need to understand what should our response be. And certainly I know that the chair and the mayor and Dr. Davila have done an exceptional job of just pushing and pushing to get some type of attention to the fact that we cannot really in any way deal with the cuts the way they're coming at us. I think we really need to regroup and think about the next response and what that response should be. And it has to be much louder, much wider, much deeper, much broader in every sense of the word. And it has to go beyond just those of us who are tuned in, finally tuned in to these announcements, but it has to reach out to every single resident in Toronto that goes beyond the public health cuts. Obviously, there will be those where we have to sort of bring back the patient and the client experience and talk about that. But really what is at stake is our local democracy and everything that's connected to that on how we make decisions for our local community, from health to transit to housing, everything. So I just wanted to say that because I know that we're grappling with, let's invite them to talk to us. Let's ask them very nicely to stop and reverse the cuts. And I think we need to really just get louder and angrier till the only thing that I know from my experience that the Premier will respond to is power and strength. And that's what's going to reverse this and stop the future announcements. And between now and 2022, I'll just say it, we change government by bullet and ballot. The Canadian way is usually through the ballot. We will have to do everything we can to make sure that they are denied a second term. Thank you.
And not by the bullet. Okay, just. Any other speakers? All right. Kate, yes.
A reminder of how deeply entwined public health work is with the work of municipalities, but also the work of the province and the healthcare system. And I think it is incumbent on us as a board to think very deeply about what the future of public health really needs to look like. What is the role of the province? What is the role of the municipality? And how do we keep local voices and community governance at the forefront? Right? We know the importance of having those local voices. And we managed to change Bill 74, the People's Health Care Act, to include in its preamble that health equity and equitable health outcomes are a cornerstone of Ontario's healthcare system. And so I think it's important for us to remember that we need to leverage the province's role, keep the province accountable for that role, and demonstrate the ways in which we as local boards are the voice of health equity, are the voice of marginalized people, and marginalization in terms of health outcomes. We're called to leadership, I think, as this board, as Toronto Public Health Board, not just here for the people that we are serving, but as we've heard from the speakers today, for those right across the province. And as I think Canada's biggest board, nationally as well. So the actions that we're taking here are vital. They are our moment to take this leadership. And so I think it is important for us to think not just about the immediacy of cuts that are retroactively affecting us and are urgent, but also about the medium-term and longer-term conversations about where public health is going and what is the collateral damage for all of our partners and allies. So we heard from the South Riverdale Community Health Centre about the work that they do that's directly funded by public health. But what about the work that they do that will be, you know, all those people that they're serving who will be further impacted when public health can't deliver on other programs and services, right? And the same thing we heard from our medical students, what will happen to emergency rooms, what will happen to other primary care providers. There will be strain right across the system. But it's not fair to just assign that work to the healthcare system or to suggest that there's no role for public health in designing healthier built environments or doing the work of prevention. So I want to argue that this is a really important time for us to think seriously about this role and to remember that there have been almost 20 years worth of reports about this, right? We had the O'Connor Report 2002, Campbell Report 2004, CRC 2006, Expert Panel Report 2017, right? And I just wanted to read from one of them. The Campbell report after SARS, that basic protection against disease should not have to compete for money with potholes in hockey arenas, right? We shouldn't be put in a position of making those kinds of choices when the funding is available for us collectively as a society. So let's think about that as we move forward. Thanks.
Thank you, Kate. I'll begin, and I have a motion to place, which is being advance circulated. It is for City Council to express its strong opposition to the funding cuts, to call on the province to reverse the cuts, and to direct our city staff, along with in consultation with the MOH, to utilize city advertising locations to inform Torontonians of the risks associated with the cuts, to request the Medical Officer of Health to inform key stakeholders, including partner programs and agencies of the impacts, and to ask our Medical Officer of Health to report directly to Council next week on the potential impacts. Let me begin my comments first by thanking sincerely Dr. Davila and her whole team for not only their leadership in the public eye, but amongst a department of frontline staff who are feeling deep angst today. And they should not be feeling that. And I want to thank and commend Dr. Davila for her leadership in seeking to provide reassurance and comfort both to her own team and to the public at large. And I also want to begin my comments by thanking both of our trustees at this table, Trustee Lapredi and Trustee Donaldson, who have been outspoken and unwavering in their work with their own school boards on this issue in the last few weeks. As you know, at this board, the proposed cuts impact every community in every corner of our city, because the programs we provide, from dental screenings for children to vaccines in schools to breakfast programs to immunization and disease control, impact every Torontonian. But what we've seen, and I think you've seen it here today, and we've certainly seen it in the news, is that this is now a province-wide controversy. that since the cuts were announced 2.5 weeks ago without any notice, without any consultation, without any warning, and which came in place retroactively, we have seen a wave of opposition that transcends political lines and geographical boundaries. The 28 mayors of the largest cities in Ontario have spoken out against these cuts. Today, the mayors and regional chairs of Ontario, representing nearly 10 million people in our province, officially spoke out in opposition to these cuts. The Northwestern Association of Municipalities, representing 240,000 constituents in the Northwest, have spoken out, along with 12 boards of health from Sarnia to Thunder Bay to Peterborough to Sudbury, from the doctors to the nurses, the OMA, the ONA, even the Ontario Pediatric Society. It takes a lot to piss off all three of those groups, but this province has somehow done it. And of course, the Toronto District School Board, the Toronto Catholic District School Board, and the association representing all Catholic trustees in the province have spoken out. And so I think the message here to our province is clear. To Premier Ford and Minister Elliott, reverse these short-sighted and dangerous cuts. And I want to convey a message to our staff in Toronto Public Health, to the members of this board, and to residents of this city. As the chair of this board, we will not let these programs stop. We will fight these cuts. We will convince the province to reverse them, and we will not, under any circumstance, allow a child who needs a breakfast program or a restaurant that needs to be inspected to stop or to not have it. And with that, I will ask for a unanimous vote on the motion. Or, with that, sorry, Councillor Perks, I can ask. You don't have to agree with me. I can ask. With that, I would ask for a recorded vote on this motion. Yes.
Out, including 311, because I remember we had a board meeting, we talked about...
Just the question, not the speaking on it. So, yes, we will take that into consideration.
And I remember one conversation we had on the board to making sure when we advertise stuff that is in multi-languages.
Yeah.
Okay? And then the last piece, Mr. Chair, with regard to the stakeholder, because we have multiple presentations recently with Dr. Kyle from Alpha, that one of the key stakeholders we got to make sure we work with is Alpha. So just making sure that, because they're the association, we have representative from our board to Alpha, to making sure that stakeholder is including Alpha.
They are a key stakeholder, absolutely.
Okay, thank you.
Thank you. Okay.
Okay, so in favor of the motion, raise your hand. So Alexander Bowery, Trustee Stephanie Donaldson, Angela Johnson. Kate Mulligan, Councillor Gord Perks, Peter Wong, and Sue Wong. And that's 13, or rather 12 in favor.
Thank you. We have two last items. I'm going to go very quickly, as I know a number of members of this board have to be in another meeting at 11:30. The next item is item 6.2. This is Student Nutrition Program Services. I will have a motion to defer this to next month. Are there any questions of staff first on this item? Seeing none. Speakers, I will speak first, and that in light of the uncertainties regarding our budget, that consideration of this item be deferred to the next meeting. I have confirmed with our staff that that in no way impacts any of the programs before the end of the year. So there is no risk to that deferral. Any other speakers? Seeing none, all those in favor? Opposed, if any, that carries. And then on item HL 6.5, I have to reopen. This is the performance appraisal, and I have to move an amendment. So first of all, the motion, I have to move an amendment. All those in favor of reopening? Carried. And then, clerks, if I can place the amendment that the Board of Health direct that the 2019 work plan for the MOH remain confidential as it contains personal information. I needed to move that. My apologies. All those in favor? Opposed, if any? Item as amended. All those in favor? Opposed, if any? Thank you very much, and my thanks for the quick end to our meeting today. Thank you.
We have the presentation.
Oh, good.
We have the presentation from the clerk's office.
Can,
Number 4.
I'm going to ask that we
You want to defer that?
will defer that one.
Yeah.
Okay. I have a deferral on the presentation, I'm afraid, to the next meeting. Yeah. So I'm moving a motion to defer item 6.4 to the next meeting. All those in favor, opposed, if any, carried. Now we are finished. Thank you.